Primary health care is the first and basic point of call in the health system. It addresses the main health problems in the community, providing health promotion, prevention, curative, and rehabilitative services accordingly. It is meant to address basic health issues, while secondary and tertiary health facilities provide comprehensive health care. In 2019, shortly after he was sworn in as the governor of Osun State, His Excellency Governor Adegboyega Oyetola, during the program in Osogbo, made an ambitious announcement that his administration was set to renovate, revitalize, and reinvigorate 332 primary healthcare centers across the state. This statement overshadowed all other activities at the said event, as it was not only ambitious, but also looked close to impossibility. Many stakeholders in the health sector doubted the realization of the statement. The doubt may be right, as no state in West Africa has done such in the past. Earlier in January that year, the federal government has announced the disbursement of $49 million to Osun and Yobe State, following their impressive performance under the Saving 1 Million Lives program for performance. Osun got $20 million from the fund. This amounts to 7.3 billion naira, as confirmed by both the former Minister of Health, Professor Isaac Adewale, and the Commissioner for Health in Osun State, Dr. Rafiu Isamotu, during separate interviews. The Executive Chairman, Osun Primary Healthcare Development Board, Pharmacist Leke Ogunshola, speaks more on that.
We were so lucky that in the process of him trying to gather resources together to start the real renovation, revitalization, and equipping these primary healthcare centers, there was a kind of estimate and then dependent analysis of what we have done, even with the state of things in the past. And at that point, we were lucky that we were given by by the World Bank a kind of independent assessment, which brought about a kind of assessment and which put us at the second position throughout the country. And at that, we were invited to Abuja, and a prize attached to that position. That's the second position that we had. And with that, that was how we came about the amount that that reporter was trying to mention there as a grant. It's not actually a grant from anywhere. It was a hard-hand price from our job, for what the sector had done in the past. And fortunately, the present executive governor of the state was part of that success, because he was the chief of staff when what the analysis, the assessment was based upon. So that was how we got the money that the reporter was talking about.
When this reporter got to Inisha, he was told that the town has two healthcare centers, one at Ward 11 and the other at Olukotun area of the town. As against what was said, here is a signpost directing people to the facility. Our reporter, on getting to the facility, was welcomed by a bulb at its veranda, signaling connection to national grid as against the reports in question. Also, the borehole, sunk in the premises, still supplies water to the facility. Our crew members confirmed this at both the delivery room and another one within the facility. It was also alleged that the primary healthcare center has no bed space, but our crew met even unused mattresses at the facility during our visit. Over 90% of the equipment and facilities are in good condition. Here is what our lens is captured at the Okini Primary Healthcare Center. It should also be noted that Okini has two primary healthcare centers, but this is the focal one, renovated and revitalized by the current administration of Governor Adegboyega Oyetola. The sources of funding for the primary healthcare centers are 1. Grant from Health Insurance Gateway and National Primary Healthcare Board Gateway. Checks online shows that the National Healthcare Act during the first time of President Muhammadu Buhari mandates 1% of all consolidated revenue to be spent on the primary healthcare, with implementation kicking off in 2018. In Osun State, all the 332 focus centers have bank accounts with which they receive these funds from the National Primary Healthcare Development Board. Heads of facilities visited by our correspondent confirmed this. Our correspondent requested for the statement of account of the Olukotun Primary Healthcare Center and even the check. The statement shows that as at December 8, 2021, Olukotun Primary Healthcare Center has a balance of 474,564 naira 52 kobo in its UBA account. Our correspondent also found out that the officer in charge, second in command, and member of World Development Committee are signatories to the account. The center has received no less than 2.5 million naira. The executive secretary of Osun Primary Healthcare Development Board explains how the money is being withdrawn by the primary healthcare centers.
When the BACPF started, each facilities were asked to open an account. True, it is a direct facility funding. It is not money that will first of all come to the State Primary Healthcare Board before going to the facilities. Because the money is sent directly from Central Bank. And it is sent to the facilities. Each of the 332, they have their accounts where they send the money to. They will do their business plan, bring it to us here for us to cross-check. We send to the state. Well, there's another committee in the state established by the federal government for that program. We send to them for approval. In that committee, we have partners, we have principal officers from the ministry, from the State Primary Care Board, we have Commissioner for Health as the head. It is at that committee that the business plan will be approved based on the guideline sent by the National Primary Care Agency. It is after the approval of their business plan that we'll send it back to them for them to use it to implement, to use their the money sent to them to implement the business plan. WDC, they are part of, like I said it before, they are part of the committee at the health facility level, the ward level, that will look at the business plan together along with the health workers.
Also on this, our correspondent speaks with Mr. Amzat Tarid Olawale, the Secretary of World Development Committee, who narrates how frequent the facility gets funding and how it's been spent.
So would you say WDC ní láti lọ bá ẹni.
We call some people OIC. He or she and the WDC member are the leaders in the management of PHC. There are some money that come into the center from the government. WDC chairman and the OIC are the signatories to the account. If they want to buy anything at the center, WDC chairman and OIC will sign check to withdraw money from the account. As WDC chairman, he represents the people of the community, and whatever the community wants, he gets it to the management meeting of the PHC. This is to ensure that the money the government is spending gives results.
As far as our facilities are concerned, we have two sources of drugs. One, I told you about the business plan. In their business plan, they have certain amounts booked for drugs. 9 accredited pharmaceutical company that supplies drug. So as far as drug is concerned, they don't have shortage of drugs. Apart from that, before we started the BACPF, and because of other about close to around 500 facilities that are not part of BACPF, Mr. Governor instrumentally released fund for us to purchase drugs.
One of the best ways of maintaining public facility is to allow residents of the area where such facility is located take total control and ownership of such facility. This model has been adopted by even World Bank. To achieve this, a monitoring committee comprising people of character and integrity was set up. They serve as link between the people and the government, while also checkmating the excesses of officials. Members of the World Development Committee are also signatories to the bank account of the primary healthcare centers under their monitoring. Mr. Olawale, who is the secretary of the World Development Committee, speaks.
My name is Amzat Waheed Olawale, the secretary of the World Development Committee. The World Development Committee had a middleman between the government and the community. They represented the community to monitor each hospital built in each wards in Osun State, of which they have renovated 332 with the remnant of about 20. The role of WDC when people visit the PHC for treatment, if they see any challenge, they need to tell their representative who is a member of WDC of what they observe at the center.
At Inisha, this reporter met with some of the residents of the area, most especially those who received treatment from the primary healthcare center. At the gate was Mr. Adetunji J.A., who spoke on the quality of service obtainable at the center.
Adetunji J.A.
My name is Mr. Ayotunji. I do come to this health center regularly, and the workers are doing a great job. I do bring my kids here. In fact, I just took my COVID-19 vaccine 3 days ago here. If drugs needed are available, they do give us and also prescribe the ones that are unavailable for us to get it at the nearest pharmacy.
Others are Chief Solomon Arifasi and Zakaria Abdulaziz.
Solomon Arifatu Akodawo Nisa.
My name is Chief Solomon Akodawo of Enisa. They are the one taking care of my kids and I, particularly. They don't collect money from me anytime I go there for treatment. My name is Zakaria Abdulaziz. They are very okay and they are working effectively. They do take care of their patients very well. They save lives of their patients.
In the said report, it was alleged that contracts were awarded to cronies of the governor. Hence, shady jobs were done. Earlier before now, this reporter has visited primary healthcare centers in Oshogbo, Obokun, Irepodun, Ede North and Egbedo local governments area of the state to assess the job done. This was done when the government announced the completion of the first 100 facilities. The board chairman, pharmacist Ogunshola, did not only deny this allegation, he also labeled it as unfounded and libelous. He went further to narrate how the execution of contracts were done. He also explained the roles of each committee set up by the governor.
These contracts were awarded and due processes were followed. In fact, I would have expected that reporter to visit our procurement agency at Aberi for him to conclude that they were given to people that were not qualified. And let him go and see the way and manner contracts have been awarded here. And he would have been able to tell us that, okay, there was one he said is a marketing company or so. If you have a marketing company, and then if you have a company and you saw it as probably part of, when you have an investment company, you have is a kind of a wide area that will contain a lot of other things. You might have, like one of them that he interviewed said, that they are qualified even to handle the construction, and he has not told us that what they did was not even to the satisfaction of the bill of quantity that was given to them. And if I were the reporter, I would have also tried as much as possible to obtain, even one, the bill of quantity and see the way and manner. And let me also remind him that the government did not only award contract like that, there was a consulting firm that was engaged by the government who went around, who did all that's supposed to be done before we now even came to the issue of awarding the contract. And usually we have processes and procedures, and it should have visited the procurement agency to see whether the due process were followed or not, because we have one, a very functional one in the state.
The Secretary of the World Development Committee also spoke on this.
The roles of
Ìpàtí
WDC during
WDC
the
chairman kó
contract
níbẹ̀
execution
ó pọ̀
were
gan
numerous
torí pé
because
pé mo ti sọ síwájú
as
bí
I
àwọn
said
ní
earlier,
aṣojú community
they are representative
focal
of the
center yẹn
community.
ìjọba ti gbé
The
tiẹ̀ jáde
government
pé
has
kí wọ́n lọ
awarded the
ṣe
contract. It
but
was left
wọ́ọ̀dù
to
tí wọ́n
us
ṣe
as
sí yẹn
WDC
tí wọ́n bá ṣiṣẹ́ tí
to
ò dá síbẹ̀
ensure that quality jobs
community
are
yẹn ló
done.
ní wàhálà
Like all
rẹ̀
the materials
so
are
WD chairman ní láti sọ fún wọn pé pákó
This
tẹ́
is
fẹ́ ló
what
bíbá
we
yìí àfẹ́
did in all
ẹ̀yọ
the
pákó
governments
kúrò
across
pákó mi
Osun
là fẹ́
State.
níbẹ̀ gbogbo tí WDC bá rí pé ó lè jẹ́ nǹkan tí wọ́n ó ṣe níbẹ̀ yẹn tó jẹ́ àjàmbákù ó ní láti sọ fún wọn wọ́n dẹ̀ change ẹ̀ adẹ̀sẹ̀ gbogbo ẹ̀ ní gbogbo ìjọba ìpínlẹ̀ Ọ̀ṣun gbogbo ìjọba ìbílẹ̀ tí wọ́n wà nípínlẹ̀ Ọ̀ṣun gbogbo focal center yẹn la rí pé àwọn èèyàn wá tọ̀ láti monitor gbogbo bí iṣẹ́ ṣe ń lọ tèmi gẹ́gẹ́ tó jáde pẹ̀lú àwọn tíìmù mi láti jáde lọ wò pẹ̀lú alága ní state.
It is really unfortunate that Sahara reporter went to town with blatant lies. And I want to challenge whoever is the reporter in charge that covered our primary health care centers, for him or her to have come to the conclusion that our primary health care centers is in shambles. Let me first of all let people know that before the advent of this administration, we have dilapidated and outright unuseful, non-clinical primary health care centers around the state. And at the advent of this administration, our amiable governor deemed it fit that quality health care delivery must be given to the grassroots. And when he traveled during the thank you tour, he saw many of these primary care centers, and he was really baffled. The kind of clinical services that would have been rendered in the past to our people at the grassroots. And for anyone who is very conversant with the state, will know that majority of our people, the highest population reside in the rural areas in the state of Osun.
We have 332 focal health facilities in the state. These 332 were involved in the implementation of Basic Healthcare Provision Fund program.